Okay, so good afternoon, everyone. We'll be starting now. So just quickly, welcome to the session for Time for Education Revolution side session. So how the session is going to happen is that we are going to have individual presentations for the first half of the session. We have 4 speakers present with us here today. So I will quickly read their bios before each presentation. And for the second half of the session, we will have a discussion. So I would invite everyone to sit in discussion groups, but we can move around during that session. How many people do we have here today? 1, 2, 3. So we might end up with maybe 3 groups for discussion, and I think that's okay. We can share groups for all the speakers. Okay. All right. So quick housekeeping rules. Okay, so if you have not had your barcode scanned for registration, kindly do so outside the hall. There is a QR code on the door. And then lastly, please remember to turn off the volume of your mobile devices during the session. Okay, so without further ado, I will introduce to our first speaker, Dr. James Chrispin Mushi. Okay. Dr. James is a medical doctor at Secuture Regional Referral Hospital in Tanzania and is currently serving as founder and director of Clinicians in Planetary Health and Global Health Hub Tanzania, founder of CUHAS Planetary Health Club, Planetary Health Alliance Next Generation Youth Council representative. He has been a Global Planetary Campus Ambassador in 2023. He has published several articles of influence on global environmental change on infectious diseases, including HIV, TB, and malaria. He has been working in planetary health advocacy and youth engagement through planetary health education, also integration of planetary health in healthcare practices. So I would invite Dr. James to the podium so you can present.
Hello, everyone. It's good to see a good number of people here. I'm assuming we're going to have a very productive discussion. Thanks for the very well introduction. So I'll be leading discussion concerning on planetary health education. So this is summary of next. So we evidenced we are experiencing global environmental change and through human activities and civilization, we have able to reach an important tipping point, but also we have opportunity to adapt and make sure like nature and our planet are with them. So we have all witnessed the emergence of vector-borne diseases, also vector-borne diseases, malnutrition, drought, and extreme weather event. All these are resulting from global environmental change. And we can all agree global environmental change is among the global health crisis, which threaten the survival for future generation. This is some of the activities, a lot of things due to human activities with each other and how we interact with nature. We having a very potential opportunity to modify, so the modifiable behaviors which we can adapt and conserve our environment. We've seen there is increase of drought, so it's threatening food security and also pollutions, environmental pollution. This is a picture from the Lake Victoria front. It's a lake which is located in northernmost part of Tanzania. We having a the lake and also activities, transportation, and also legal deforestation, but how we interact, it has led to environmental pollution. So there's an opportunity to see how we can modify some of our behavior to have a sustainable life. And I see these are children which are really the investment for the future generation. They are all in danger due to global environmental change. So we can all agree we are really living in an area where the environment is affecting us so bad. So I want to give the statistics from our health organizations. We have experienced more than 13 million people only every year, and among this with about 23% due to modified environmental factors. These modified environmental factors are including soil pollution. So we are having a very nice opportunity to modify some of our behavior so that we can increase about 20.3 to 25% of the youth we experience annually due to global environmental change. I am from Tanzania, and this has many effects. Also, it's now becoming a public health emergency. Yeah. So we went toward the mental health education. So we are having another opportunities we have is young people who are the future and also who are the investment for our generation. So we know mental health is in solving this current change related to human interaction with nature, but we need to integrate mental health in education system. The main agenda is to prepare the young adults against emerging health threat and also environmental dynamic. We're experiencing a lot of issues resulting from climate change, ranging from extreme weather event, more diseases, outbreaks, and pandemics. And so I was having a number of projects I was working on is on how we can expand parental health education because we have seen it's an opportunity for everyone. So everyone can have a commitment to engage in parental health education because it does not need to rely only on stakeholders because we need to work in a junction from top to one where everyone are being engaged to this end. And another top action plan with the youth. For the youth and also the community will be engaged, will be the action maker in this. Oh, thank you. So among the idea to share is what opportunities do we have on establishing of clubs in engaging in environmental health education. I was able to establish course parental health club at Catholic University of Health and Environmental Science, which we started with 104 members, including queer staff, medical students, nurses, and laboratory nurses, and we're still open to members. So among the vision we had was to engage Tanzanians in promoting health and empowering them. And also our vision was to create a and expand the family solution in the area. Through the clubs, it's an opportunity of training the leader for peer training, and also it's an opportunity of students and also the youth to engage and be productive in the community, using the local knowledge on the cultural diversity and also interact with the community. So we have three focusing pillars on education, research, environment, and the community program. It's good to explore because they work in the universities at an academic center. So it's very important to use the research to understand what the community needs because we need to do research and to learn area to intervene to have what input to the community. So it's a series of activities which was being to this features of various occasion working with a medical student and sensitizing them on what planetary health means and what opportunities we do have in planetary health. On the next side, we wanted to travel to other colleagues apart from us, trying to sensitize them on planetary health because we really need to be able to be continually discussion so that for this to be implemented. As we know, planetary is an interdisciplinary approach, so we really need to put into people engaged and everyone to work on interconnectedness. But also, we also able to organize workshop and and conferences. We are very happy and acknowledge our university for giving us full support. We want to engage and the session at the CUHAS University. Also, students were able to present a project and proposal to go to most of them doing the proposal. And also, it's encouraging to students to conduct their research in a university in a planetary perspective. Also, through the club, we're also able to engage the student and the community because mixed connecting the community is another critical of learning. You can see the environmental cleaning. I think we have a center poster there. You can see Citi campaign on environmental cleaning at Kamanga Ferry in Mwanza region. We had a lot of plastic waste. It was also opportunity for us to collaborate with some of the business companies who are producing these metals. So among the agenda was to advertising what opportunities the community have in saying that the youth need to have and get some source of income and at the end of the day we have a clean environment. We also clean because we know we're having enough and because the bank and the fish and the ecosystem everything. So among this, it's a summary of an agenda of event. Most is insisting on reusing instead of using once and disposing. So these are companies for juice and the most because they're very contributing to the plastic waste in Tanzania. And also we are also able to insist give them the donation of some of the plastic bins so that at least the environment should be clean. So they can put some of the waste there. So in late February this year, after my experience with outbreak in Northern region, I was working in the healthcare sector, calling it one of the diseases which was coming because of a serious rain, and we still suffering in the area. Reason the fact that Northern region is another hill. The infrastructure, some of the communities which are located at the long area, they experience serious floods. And so, following outbreak, it was really challenging because I've advanced with my experience among the complications. A lot of people experience serious dehydrations, electrolyte imbalance, and also it has led to heart-aching injuries. So we experience people need to cholera. And so among the intervention we had community-based approaches is not even awareness of what measure how they can adapt to the outbreak which is already existed. This is the goal achieved. Also, to do some of the cleaning equipment, we can see the posters for awareness of the community on cholera. Concerning food hygiene, washing hands, good proper use of sanitation and cleaning, because you know cholera is a disease due to parasites in fecal matter. Oh, thank you. So we also engage in planting of trees activities to maintain biodiversity, collaborated with African Survive NGO based in Tanzania for planting of trees. And also internal from areas and of television. I was also able to have an interview with a channel on CTV talking about climate change, impact on TB and HIV. And also we used also some of our social medias from Tanzania, try to link them because climate change is affecting infectious diseases and non-communicable diseases, and almost all perspectives was refined. So illness was awareness and trust sensitization so that we can use the available established infrastructure to intervene and work together. So I want also to share the opportunity we have in sport. So we can also use sport to advocate for mental health. We also have more detailed presentation I think from the next presenter concerning how we can use sport to campaign for mental health. So it was a program based on trees and maintained by the university whereby the team which was the first to win because it's based on universities. So the universities which are teams win the internal competition is only 500 trees to plant in their campus. And also other participants will trees by one. So if you score one, you give one tree. So the aim is to raise engagement in physical activities, and also maintain biodiversity. As you can see, there are a lot of opportunities and areas whereby farms can be productive in transforming, because we have the evidence, how we are going to put that into action. So one of the long-term plans is to engage the youth all over the country to mental health advocates. So currently we're trying to engage more universities and see how we can have a national program to provide them with mentorship and to ensure sustainability. So we had a long-term plan also to conduct research which can be impactful to provide a solution to impacting many issues of climate change in our country. So I wanted to conclude planetary health and education at university is a very important aspect in bringing sustainable solutions to the changing change. So we also intend on integration of curriculum. We've seen the challenge today in the presentation. Sometimes you can see the limited space on curriculum, but at least everyone can do a change. So you can, with the movement going on, everyone can be part of the movement and ensure that mental health is being practiced, it's being educated. It's not like a full to the action and helping the people of the community. Thank you very much.
Okay, thank you very much, Dr. James, for the very illuminating presentation. Without further ado, we would like to move to our next presenter, Dr. Amjad Muhammad Saleem. So I will quickly introduce Dr. Amjad. Okay. So Amjad is the orchestrator, aka manager of the Volunteering, Youth and Education Development at the International Federation of the Red Cross and Red Crescent Societies based in Geneva. He leads a global team focused on education development, innovative youth engagement, and volunteering management. He has worked in different perspectives of humanitarian work, interfaith engagement, and peace building. His publications include journal articles, several book chapters, and a book on lessons from Aceh. Amjad is an alumni of the International Visitors Leadership Program and the Geneva Center for Security Policy. He is also a research fellow of the Faculty of Education, University Malaya, Malaysia. So without further ado, I'll hand over the podium to Dr. Amjad.
Thank you so much. Good afternoon, everyone. Thank you for joining here. Just to put a caveat, because in a room full of doctors, I'm the least doctor, which is I'm a PhD, right? So I got to put that there because often people start coming asking for medical advice and things like that. So it's just to kind of put that in there. But that's the most doctor. Oh, okay. Thank you for being. I am part of the International Federation for Red Cross, Red Crescent Societies. We are the secretariat for the 191 national Red Cross, Red Crescent Societies across the world. So guaranteed that whichever country that you're coming from today, you will have a Red Cross or a Red Crescent Society there. That means that we have 17 million volunteers and half of them are under the age of 30. So that's almost 7.5, 8 million young people who we're engaging with. So it's a huge population of people that are there. Most of you probably recognize Red Cross from humanitarian work or from first aid or from blood donations, but you probably would be surprised to know that we also do a lot of work in terms of development, youth engagement. And that's why coming today, it's really kind of sharing with you some of the work around particularly non-formal education and sports. And it's really about that behavioral change that we're talking about, getting people to be much more active members of society. And this is something that I think we've talked about over the last couple of days. The next slide. So all of us here know about planetary health, and I'm not going to go into sort of the technicalities of this, but just go on. But we know that because of the changing social demographics, one of the challenges that is coming up that we're facing with planetary health is the accelerated changes in society that young people are in particular facing. And that is affecting educational opportunities, that is affecting mental health opportunities, that is affecting people in terms of how they view the future. And we heard that today. I don't know what many of you attended the session just before lunch, where part of the conversation was this anxiety that young people in particular were facing about the future, right? And in fact, to such an extent that some people are saying, oh, we don't even want to have kids. And I've come across that. You know, we just don't see a future. And that's a huge pressure to have. And so the question is, what is required for young people in particular, but not necessarily? What is required for them to feel like they can make a purposeful, positive contribution to society? What are the skills that are needed? What is the appropriate knowledge and attitudes that are needed to actually help that? And the challenge is that in our formal education systems, we actually are not creating those spaces for that. Most of our education systems, the formal education systems, are just creating people who can pass exams, right? And I realize the irony of standing in the university saying that, but the fact is that most of our formal education systems is there. We're not creating the opportunities for people to actually understand how they can be a better citizen. Next slide. And that's what non-formal education is about. So non-formal education is really a structured or unstructured educational activity that allows young people in particular to develop a range of skills and competencies outside of the formal educational curriculum, that allows them, that is more flexible in its delivery, that is based on 4 learning pillars: to be, to do, to know, to live together. We can just go. It's around inspiring people to do better. It's around providing opportunities to be more inclusive, because non-formal education traditionally was used as a way of reaching out to communities that could not be included into the formal curriculum, whether it was stateless or whether it was what they called marginalized communities. But it is also flexible in the sense that formal education curriculum follows a rigid structure, but whereas non-formal education can be tailored to meet unique needs, interests, and learning styles. So it has this ability to provide a different way of learning through workshops, through community programs, and we heard from James early on about some of the things that he's doing, which for me was really about non-formal education. So what does this mean for, next slide, what does this mean for non-formal education, planetary health? Well, actually, what this means is if we really want to help people understand what planetary health is and to get away from sort of the science of it and the technicality of it, right? It is around promoting understanding of interconnectedness. It is around encouraging critical thinking, fostering a sense of responsibility, voluntary participation, and innovative learning. And so this takes us to the role, particularly what I want to talk about around sports. Next slide. Because sports is also a catalyst for change, right? Sports is something that brings communities together, right? That allows us to convey core principles around tolerance, solidarity. It allows us to reach out to communities. It allows us to teach certain life skills. And so when we talk about sports and planetary health and non-formal education, we're talking about values, we're talking about youth leadership, we're talking about the promotion of health and well-being, life skills development, community engagement. All of these are opportunities to bring the channel of sports through non-formal education to talk about something in particular. So what does that mean for sports, non-formal education, and planetary health? Next slide. It means that you can develop an integrated curriculum and programming. And when we talk about integrated curriculum, it's not sports for the sake of doing sports, but it's about using sports to bring in people and then teaching them some values with it. And then allowing them to go out and do something. Because the strength about non-formal education is that it allows you to do voluntary participation, which is why organizations like us at the Red Cross or the Scouts or the Girl Guides are excellent ways of helping young people actualize what they're learning. They have non-formal education that they learn, and then they go out and do something as a volunteer. And it also gives them the empowerment and advocacy. So from our perspective, what I just wanted to share with you was just a project that we at the Federation ran with communities here. And I was using football to kind of bridge vulnerable communities, where we brought them in, we taught them some life skills. We gave them some startup money to actually then go out into the communities and do something with their lives. And so just in the last couple of slides, what I want to do, if you just go to the next one, is just to kind of share with you something. We worked in 4 countries over 18 months, managed to reach 22,000 young people directly impacted by this. And just looking at the scale of projects there. And what this meant was that we were going to young people and asking them, tell us your problem. Tell us the solution that you think you have to your problem. We will help you to overcome that problem. But the way they came in was through football. Because if you had asked them to come into a classroom, they wouldn't have. But it was using football to bring in, giving them skills in football, coupled with non-formal education skills, and getting them to do some critical thinking. Just next slide. I know I'm running out of time. So just some observations there. I'm happy to share the slides with you, but I just want to leave you with the video that was there. So if you can just go to the video. Next one. This. Okay, yeah. Just play the video. And the sound. No, there should be sound. I have now caused a technical mishap in all of this, right? We did everything, we were perfect. It's okay. Again, these QR codes, if you want to check out some of the videos of what's happened there, and please go ahead and do that. And then just in conclusion, that is there. Sorry, people taking pictures, but sorry. Just to sort of say that, look, non-formal education is a critical role, plays a critical role in providing flexible, inclusive accessible learning opportunities to empower individuals and communities. But the power of sports like football, and did have an activity to do, maybe if we have some time later on, we can do that. You can leverage communities and young people in particular, and bring them around something. But this has to be coupled with learning, proper learning, and then allowing them to go out in the community to do something, to give them that agency to actually then think about what they can do and give them that power to actually go out and there. And that's, if we want to raise awareness about planetary health issues and to inspire individuals to become active stewards of that environment, then these are some of the initiatives that we can do, just to think a bit differently. Because otherwise, we're not going to be able to get the change that we need to see if young people are not able to feel like they have that ownership. And if we don't go to them at their level. And with the communities that we had, it was really football that got them there. But it can be any sports. Thank you.
Okay, thank you so much, Dr. Amjad, for showing us the power of sports in building community. So I would like to move on to the next presenter, Dr. Shiwei Ui. So a quick introduction. Shiwei is a climate health justice activist, doctor and educator. She furthered her study in medicine at Leeds, UK. At university, concerned around the lack of planetary health education in the curriculum, they started a society called Leeds Healthcare Students for Climate Action, dedicated to enhancing the understanding and confidence of healthcare students on climate health at its intersections. They are also part of MEDECT and a National Health Justice Group, where they have actively contributed to the coordination and promotion of awareness around surrounding health justice issues. So without further ado, Shiwei, you may come to the front and present yours.
And I know we're short of time. Hi, everyone. My name is Shiwei, and I'm aware that some of you may have heard of my talk on Tuesday, but I changed it a bit, so it will be a bit different. It's nice to meet you all. I understand it's great that you're concerned and about planetary health. I have been very kind of like fangirling with everyone at the moment, just seeing what they've been doing. Just to introduce shortly, I'm a doctor, climate health advocate, and also like to teach people. And next slide, please. And so like how I'm sharing my story because I think we've been hearing how like communication and like the narrative of what brought you into planetary health, why are you guys concerned about planetary health? What got you involved? And it's so important because this is how like I've been able to do a lot of things I do. When I'm on placements, when I speak to other doctors and at work, they ask me, what do I want to specialize in? They ask me that all the time. And I want to do public health. I was born in Malaysia, and my mom would tell you that I used to like choose the human anatomy book compared to an animal kingdom book. I was a weird child. And I really wanted to do medicine. I cared about the science. I wanted to help people. And that's how I got into medicine. And in 2015, I went to Singapore to study alone because my mom is from Singapore. And to further my education, I used to take the public transport by myself to the school where I went to. And as you can see, I don't know if you know about, Indonesia actually burning trees to help fuel the palm oil industry. And as like a young child with asthma, I'm like, why are they doing this? Like, why are we not allowed to go to schools because how the air pollution is so terrible? And why are humans doing this? And I didn't really want to do medicine because, humans like are causing all this climate problems, but we got there. And I'll share more about the society I started in a bit. I want to highlight the situation in the UK. I made this slide yesterday. So I just wanted to make aware of like the current situation. We talk about the UK being like really good in their sustainability, but in 2018, the GMC, which is the General Medical Council for doctors, they've actually introduced sustainable healthcare as something that doctors need to know about. But no, but like how well this is, introduces the question, isn't it? In 2018, we've seen the movement from Greta Thunberg, which we all know, and that really catalyzed, youth. It showed how like youth coming together can actually drive change, and she's formed a whole movement that inspired, I'm sure, a lot of us. And that's how HESCA and the Planetary Health Report Card was born in 2019 in California. And obviously we know the pandemic hit us quite hard. The NHS actually declared they're wanting to be net zero, and they were the first health system in the world to have achieved this in 2020. And the Medical School Council, my colleague actually worked on this project where they got all the UK medical school deans, right, to come together to enforce education for sustainable healthcare. And in my university, the dean of medical school, they weren't there. Like, so it shows how much, the support that we've got from the medical schools. And in the top picture, you can see health workers, being, on the front lines. They're concerned about like how, air pollution, like we've seen how the climate crisis is affecting our health. And it's scary. And we've seen a lot of like protests that people on the front lines showing their solidarity in the movement. And now. And actually today, interestingly, the GMC, maybe in 2 hours time in the UK, the Health for Extinction Rebellion team are going to be in London, calling on the GMC to address the climate crisis and provide more leadership and education into doctors right now. And our colleagues in the UK will be, on the front lines. There's going to be media, there's going to be people supporting, hopefully, or denying these concerned doctors. And this is how protests can literally make change. And so a bit more about the society. So HESCA, we started out in 2019, just a group of students just concerned about the climate. And we wanted to bring it into all healthcare departments, whether it's nursing, midwifery, dentistry, to talk about planetary health. Because I think it's a bit scary because like for education to actually change, it can be really hard to incorporate it into the medical curriculum. So I felt like we couldn't just sit there and do nothing. And that's why I started the society. And I'll just mention the report card. I'm not sure if you know, they are a great group of people, now international, assessing how well or bad medical school or any healthcare school is in sustainability. And this was a great way where this is what we used as students as an in to talk to our medical schools, because no one wants a bad grade, right, from a high level university. So this was a great way to challenge your medical school, like, why are you not talking about sustainability? And we got support from the sub-dean of medical school, which was very, very like beneficial for the stuff we've done. And this is the report card that we've done. I'll just move on because of the lack of time. And yeah, next is regards of education. So we started a sustainable healthcare series, just looking at like collaborating with other societies. So there are lots of climate action societies in the UK, which is great. And why reinvent the wheel when we can literally just come together online to talk about sustainability. And we had experts in the field talk about this, which is really great. And Carbon She Took It, I'm not sure if you know, it's a charity based in Manchester in the UK. And they basically teach people about what carbon is, if you don't know what it is, like the really basics of things. And they work with like lawyers, like economics teams, like medicine people. And we worked with them to create the first healthcare students one. And it was really good. We've won a lot of awards. Definitely recommend checking them out. And yeah, things like, dragon dens can be quite fun. Yeah, just getting people in a room, thinking about ideas and trying to implement this. A bit of community. So I think a lot of the work we've done is trying to raise awareness with the public about why like healthcare professionals are concerned. And we like hosted climate clinics where there was literally a bed in the middle of a town square, like trying to get people to talk about climate and why the public is concerned, and we can also share our concerns about the climate crisis and how it affects their health. The tree planting, which is also really fun. Next slide. And litter picking, which is always very wholesome. Like we have students, we have doctors, we have members of the public come, and it's a great way to clean up the area and also, just share more about, it's like this like community vibe, like, and which I think was very successful. We've done this many times in our society. And with socials, so we've done things like swap shops, so kind of organizing this with the university union, which they were able to publicize it quite widely, and people came in and drop off their clothes, and they were able to take something home for free, really. So it's literally guilt-free shopping, and it promotes the circular economy. And I think this is the part where like we talk about climate clinics, like what we call it is called has chat. So it's like a nice space for us to just speak about climate, just to chill, go to a nice coffee shop and enjoy talking about like what are things that we're concerned about, things that are good that are happening. And it's a great like casual way to talk about climate. And we've taken this report card to conferences, which is brilliant, just to raise the awareness about climate and health. And we also were able to, this is very key because we spoke at the Clinical Teachers Day where it was just like medical educators, I think over 150 of them at the University of Leeds, and they were listening to us. They came up to us and said, like, you reignited my passion for sustainability, so we were able to find a sustainability rep, and that has been very helpful, and work with the clinical skills department to implement more research projects around improving sustainability in the clinical skills department. What are the barriers? So I think one of the biggest things, this is from like what I've been told, clinicians are already in medical educators, they're very, very like saturated in what knowledge they have and what space they have because the curriculum is already very, very dense. And, some of them might not even know what planetary health is. And, funding obviously can be hard in any situation, but that's one of the biggest barriers also. And the Dean of Medical School were actually really, really supportive. They wanted to introduce like a planetary health rep in each specialty to think about planetary health and some points about it, and they could feed it back to the specialty leads. And you can get a certificate at the end. But how do you expect like a fourth-year medical student to do research for the medical school when we're already so far stretched and stressed with our exams? So that wasn't really, really feasible. Lack of support from some seniors, and planetary health is a neglected specialty, unfortunately. This is my last slide. I'm sorry for the time. But takeaway message, I think, education, you are all here and I'm sure you're concerned about education. We've heard this echoed in many talks already. Using the planetary health approach, not like as a planetary health module that we put into the medical curriculum, but actually embedding it in everything we do. And, calling our leaders, like seeing the protests, like what our colleagues in London are doing in a couple of hours, sharing our concerns, showing up and using your voice because there's power in people. if you don't have one, start your own climate action society. Like, I couldn't wait for someone to do something, and that's why I started HESCO. But yeah, I think that's, and I just want to acknowledge the Center for Sustainable Healthcare. If you don't know already, they do amazing work, and the principles and the quality improvement, definitely should check them out, and MedAct, which I'm part of. Yeah, that's it. Thank you so much for listening. Thank you.
Thank you so much, Dr. Shiwei. So we shall move on to the next presenter. I will give you a quick introduction of Miss Felicia Yoon. So Miss Felicia Yoon is an actual science graduate from London School of Economics and holds a teaching diploma in Bahasa Melayu. She co-founded Arus Academy and possesses over a decade of educational experience. Felicia has numerous experience in curriculum development and content creation. She led the content development of Asas Science Computer teacher module with the Ministry of Education to equip teachers with teaching material when the ASK curriculum was launched nationwide. Presently, she leads an alternative learning center in partnership with Buku Jalanan Chowkit, delivering quality education to underprivileged stateless children in Chowkit through community contextualized project-based learning. So I would like to invite Miss Felicia to the stage. Okay, thank you very much for the introduction. So as many of you can observe, I am a little bit different from the rest of the speaker, but still very in line with the topic in today's session, which is about education revolution. So I'm coming in as a perspective of an educator working with the community, providing them with education. So just like an educator, I love telling story. I like to sort of start by telling you a story. And that's why it's blank at the moment. So it's fine for it to be blank. But this story goes like this, right? About a year ago, I attended a networking section. And as I was going around, I bumped into someone from ECM Libra. And he was one of the high up people. And I was just saying hi to him. And then I said, I'm from Arus. And then he was like, Arus? And I said, yes. And then he was like, oh, I know Arus. I met one of your students. I was interviewing student for scholarship, and your student came, and I remember this boy because I look at his CV, and it was very interesting because I saw his SPM result was not the best. A few C's, D's, you know, B's, and maybe one A. And then as I flipped through even more, it just had a lot of Arus certificates, STEM competition, and so on. And so I tell you this story because this boy that went for that scholarship interview, thankfully he did get the scholarship. And right now, he just graduated last year with a computer science degree and has a starting job of more than 4,000 ringgit. And that is quite impressive for a small boy from a little town from Bukit Mentacham. And I'll tell you this story, right? Because this is exactly why we start this social enterprise focusing on education that is experiential for students, mainly for students who, when they go to school, they don't see the relevance to what they are doing in their daily life. A lot of students, they go to school and they feel like they're not really interested in what is being offered at school, mainly because they don't see how they can apply it in their life and how is it meaningful for them. And so back in 2015, the four of us, we were from a program called Teach for Malaysia. And that's how me having an actuarial science degree got into education. I wanted to actually just come back to Malaysia and contribute. And without knowing that, I stayed on in education. And even now, I have no plans of leaving education. So the four of us became teachers for 2 years. And during that 2 years, we realized that this was the key. Providing meaningful education is how we actually keep students interested to learn, because education is not about words in the textbook, but if you think about it, education is helping our students to learn that when you understand science, science was created not to make your life difficult. You know, why we're learning algebra, but algebra helps you understand and learn about the world. And that's why all these subjects were created in the world. And that is something that we truly believe in. If you go to the next slide. So when we first started, this is our humble beginnings, and it's very easy to remember when we started because we did this on Valentine's Day. So we gathered our community, we built everything from scratch. We wanted our students to have that sense of ownership of the space. So we just got a bunch of wood, metal, and then we built tables, chairs, we scraped the floor throughout. And within almost just a day, actually, or a few days before we started, it became a learning space where students, next slide, where students could come and could learn about something that's relevant to them. So when we first started, we focused a lot on STEM education, and this was intentional. So where we started was in Bukit Matajam. So we were all sent to the north to teach, and after we finished our 2 years, we wanted to stay with the community that we already know. And Bukit Matajam, for those of you who don't know, is a little town in Penang. Penang is very famous to be a tech island, not just for the food, it's also very famous for food, but a lot of technology comes from there. And our students especially are surrounded by factories that produce handphones, chips, computer chips that you use right now. But their parents, their community are never the creators of it. They are all the factory workers, the lorry drivers. And so we wanted to show students, right, that they could also be creators of this technology that they see every day. So we equip them with hard skill like programming, but we also equip them with soft skill. We use a lot of design thinking. We allow them to actually explore what are the problems that is really affecting your community, right? Not just your community, but even yourself. What are some problems that you face, and how can you use knowledge that you have to actually solve this problem? So we bring them a lot of competition. They were very lucky. We got to meet a lot of the ministers for them to actually present their project. And one of the highest achievement by these students was that they were even given the opportunity to go all the way to Silicon Valley to pitch one of the ideas that they created. We go next slide. And so these are just a competition. Next. So in line with that also, innovation alone wasn't enough, because in this day and age, if you're not able to share your idea, you can create a lot of things, but you need to be able to communicate what is it that you created as well. So we also are very active in TED. So TED, TED Talks, they have an education arm where you can actually start a TEDx club anywhere in the world. So next. So we started that. So when we first started, we wanted our students to be able to share amazing ideas that they have in order for people to actually hear their voice and be seen out there as well. So we engaged with different TEDx clubs around the world, and that was how we started to get them to communicate a lot better. Next. Yeah. So throughout the years, we had a lot of opportunities to learn, because for us, right, the core was not to sell any service or product, but really how and what can we do to make education meaningful and relevant for our students. So we work with many different partners, especially government organizations, but also private, right? Because they're the one who has the money. So a lot of times we will get the private money and we would channel it to the underprivileged community. Next. And through all this learning, we sort of realize what are the core things that we want to do. So as mentioned during the bio, one of the first few learnings we got was actually working with the Ministry of Education. So actually, if you go on the Ministry of Education, Bahagian Pembangunan Curriculum website, you can still see many of our modules up there, but you will not see our name there, because the goal was not really, for us to create, but actually to share it out. So right now it sits with the ministry. We were actually one of the core teams that helped develop the Art Science computer curriculum, not the curriculum, but the ones who actually develop teacher module to actually help the teachers with the new curriculum. Next. And on top of that, throughout our journey, we also had the opportunity to learn the value of financial literacy. So as the students were doing their project, we realized, okay, money was a very important topic. Our students were mainly from the underprivileged background. We realized that it's so important that they actually think about money and they learn about money. So quite a few years back, we started a lot of financial literacy program. And right now, our financial literacy program has grown into a nationwide program. Last year, we just had our second national competition. And it's not just a competition where you think like, okay, financial literacy, right? Surely it's a pitching competition, a business competition. We have that. We call it Kerja Impian, which is chasing your dream. So the entrepreneurship track is about finding your ikigai and how do you then make money out of it, right? And then we also have a different part where it's talking about basic financial literacy. Next.
And on top of that, one of the other projects I wanted to share was this board game. So I am an avid board game player, but also collector for maybe not so good reasons. I buy them, may not play them all the time. But UNICEF came to us and they said, there is this child rights convention that Malaysia has signed on, and we've committed to say we want to be part of it. But they realized there's not much action towards it. So rather than doing a workshop with the student, what we did was that we created a board game. So this was a board game played as a, collective. Okay, they had I think it was more than 4 hours, about 6 hours to actually solve this problem. So we call it guardians of the children. And each one of the children had a role to play. Some were prime minister, some were minister of health, some were minister of education. Every round, they need to create policy, create movement in order to provide 3 things to the children on the board, which was education, healthcare, and safety, the 3 basic needs for children. So one of the ways we like to do education is like this, very gamified, allowing the students to really be the voice, because who else to advocate for children if not themselves? And you'll be amazed by the policy that they actually come up with, because we would throw them real life events. We would throw them events about, hey, what will you do? School closure, suddenly all the children on the board cannot go to school, cannot receive education. What will you do? Next. Okay, so right now, you go next. Okay, so throughout the whole journey process of sort of learning, we decided that actually there are 4 things that we want to focus on. The first one is on STEM and digital literacy. Second is on financial literacy. And the most recent one was actually media information and literacy. This was fueled by the pandemic, seeing that so many of our kids go online and don't know how to use social media. Knowing that it's a very powerful tool, we don't want to prevent our kids from using it, but how can we use it better? And of course, to tie it all together is the global citizenship education, which Planetary Health is very much included in it for the students to find context and meaning in terms of what they learn. Next. So I want to talk about what I do currently. So after doing all this, and we were doing it through the non-formal education approach that Dr. Amjad was talking about. And I truly agree, right? There's so much flexibility. There's so much depth that you can do with the students, because it's truly something that they enjoy and they find meaning in. But with that, we also had an opportunity about 2 years ago to go into the space and provide full-time education to students that would not get opportunity to study in formal education. So that's what I do, and that's where I came from this morning. I just finished my class. I left a bit early. These are students. You see, this is the total students that we have back in 2000, just 2 years ago. Now I have about 90 students at my center. And these students, they're mostly here because they don't have enough documentation that allows them to go into national school. So with these students, right, it's even more important that we provide them with education that is meaningful and useful for them, so that they can use these tools to fight for their own basic right. So the approach that we use, you can go next, is what I call project-based learning. It's not what I call, but it's a teaching methodology that many educators know. And even the Ministry of Education in Malaysia is looking to adopt this. The very first project I did with my students, because of the background, was actually on child rights, or actually their basic right. A lot of my students, they actually were a little bit confused or didn't really think about what is their identity. A lot of them, I would say almost all of them are born in Malaysia, but pretty much all of them do not have an IC. So sometimes they're very conflicted. They feel belong to Malaysia, at the same time, not really as well. So this was an activity that we did with them, where they actually learn how our government formed, how a policy made, so that if we had a lot of simulation where they could then come up with suggestion, what should they do if given the power. And at the end of the project, they will always have a project outcome. So the important part of PBL is not really the last project, but the milestone throughout the journey. But at the end of the project, one group of students, and these are the older students, the secondary students, created a website. And this was during the pandemic. They really wanted their voice to be heard. So they made a website very similar to Humans of New York or Humans of KL, called Cerita Kanak-Kanak di Chowkit. They got all their friends to actually submit online writings to them. They will edit and they will put it up on this website. Next. And themselves, right, coming from underprivileged background, they also realized that actually so many of their friends were lacking gadgets. They were fortunate enough that we had funders that provided them with gadgets to learn. And so they started this campaign, Gadget Untuk Semua, and they managed to actually raise 14,000, and these are secondary school students, to give out gadgets to people from other community, not our community, because our community was funded. Next. And talking about sustainability, because this is the topic of the conference, we also had a project on food and nutrition, because we realized in community like this is something not often taught to them. They are in situation where they just live with whatever they are given. They don't really think about health very much. So we got our young student, our primary school students, to have a mini farm. So they learn science through that. They learn how to measure their growth. They learn different nutrients that you need to provide to the plants. And at the end of this whole process, they actually did a pop-up restaurant at our learning center. So we had a one-day exclusive. Most of the people that came were my friends to support their one-day restaurant, but we were paying customer. They came. Our students designed their own menu. They cooked their own food. They planted a lot of basil, so they decided that they would do pesto. This was all done by them. They had a day where they tested different recipe and so on. So that's one of it. And our secondary school student, next, they had a bigger task whereby they were engaging the community to see how can they get communities to actually grow their own food. So our communities have two main problems. One, people that have zero space in where they live, and one with very little space. They have some space, but very little. So two groups came up with two very different ideas, catering for both of this community, and they made sure that whatever prototype they made was entirely from materials that they can find from their own home, so that then what they did was actually they pitched back to the community, this is how you can actually grow your own food. Next. So I could talk on and on about my students. This is another project that they just did last year. It was on moonshot idea, and you'll be amazed, you know, what these kids are able to do. My students, they wanted to look into nuclear fusion to provide clean energy. They wanted to use magnetic levitation because a group of them learned Japanese. They were very fascinated by the bullet train technology, which is magnetic levitation, and they were thinking, why not launch a rocket with it? If you can power a high-speed bullet train, why not launch a rocket? And they had a whole presentation about it. And it just amazed me how much they can do, right? And I want to close with sort of another story. And I show this orchid because just last year, I met up with one of my friends and we were just talking, you know, and then she told me this story about her father. So during before the pandemic, the father would collect orchids. And like many Chinese, you know, when people give you something, even when it's expired already or, you know, it looks like it's dead, you will not throw it away. So same with the orchids. So the father had a lot of orchid that people would give, especially during visitation, Chinese New Year. And the father would keep all these orchid until many of them look a little bit dead. But just a few weeks back, she was telling me, suddenly, all the orchid came back alive. And this is a real picture of the orchids. And what happened was that she said, when I asked her, like, so what happened? It was just a random chat that we had. And she said, during the pandemic, the father spent a lot of time caring for this orchid. The father would try different ways. So even though it seems like all these orchids were dead, and it seems like there's not much that you can do, but he kept trying. He put different fertilizer, tried different method, and one day it just bloomed. And to me, right, that is exactly how I see a lot of children. A lot of times we see them in situation where we feel like maybe it's quite hopeless for where they are, but with the right care and attention, I sincerely believe every child can succeed in whatever form that we can imagine for them or for themselves. So with that, that's why I sort of do what I do. I'm more than happy to share more, but I will stop here. If you give me or you give a teacher a mic, maybe the teacher will not start talking, but I will end here. Thank you.
Yeah, so we have come to the end of the session, and to the speakers, thank you so much for your interesting presentation. We can give a round of applause to our speakers of the day. So probably we'd like to open for 5 minutes, open discussion or any questions to the speakers. Do you have any questions to ask to the speakers?
Thank you very much. It was very interesting presentations about education. I am coming from university leadership, and always when we offer some even out of some programs offered for students, not in the curricula, like additional some other courses. We always provide some certificates, and somehow we are going to document it, and that's with community with working with children and educate them. Do you give some certificates or something that in the future can use for their future life?
Excellent question. So that is something that to me is also very important. I think it's important to equip them with all this skill, but what about their future, right? So every project-based learning that we do, we map it to the Malaysian National Syllabus curriculum because I've experienced working with the curriculum department. So we are actually getting the students to also take the Malaysian National exam. And this is quite a new thing in this community because last year and before this, none of the students have taken any official exam, but last year we managed to send 3 of our students to take the Malaysian National Exam, SPM, and they just finished that right now. So we're hoping that that gives a lot more hope and opportunity for the other students within this community to at least get a certification with the effort. Yeah.
It's a good question. I mean, it's not just about certification, right? I think it's also about that appreciation, right? I think so. What we're seeing is a lot of people also want to kind of be, they want to have the likes, right? So they want to put something on social media and have all these likes, and they want that to be done. I think we need to figure out new ways of getting that done. And so, for example, there is an initiative called Goodwall. So if you type goodwall.io, it is actually a LinkedIn for young people, and it's a campaign that anywhere around the world you can actually go up, you can put forward your project, and young people will then verify that, and that's a way of promoting and encouraging that. So I think it's important that it's that encouragement and that appreciation that is there. And just sort of say that this also shows a trend in terms of how we view volunteering. Previously, people volunteered because they wanted to give back and they felt good about themselves, and that's still there. But we also sort of see people volunteer because they get this learning, this lifelong learning, and they get these certificates. And I think we need to be much more cognizant of that.
Right. Thank you so much to the speakers, and thank you so much to everyone for participating in these sessions. We have come to the end of the session of the day. Thank you again. See you all soon.